brainstorming sessions on vaccination. Let us move on to breast cancer. I think today is the last day for the breast cancer awareness month. So let us not, isko chhodna nahi chahiye hame. We should definitely pay a lot of attention to this. And I would just begin with the FAQs, frequently asked questions. What is the most common breast cancer in women? What is the most common breast cancer? Types of breast cancer? Be precise, please. Yes. The next question. So this is the pathological or histological classification. According to this, to be precise, it's 75%. The next is most common age for screening to begin. 40. Very nice. 40 years in average risk women and earlier, 30 to 35 years. That means if in case high risk is there, strong family history, BRCA positive. Moving on to the third now, I'll be a bit swift. First line imaging in women less than 30 years with a breast lump. What else? Breast ultrasound and mammography is reserved for suspicious or high-risk cases. What is triple assessment in breast cancer diagnosis? One by one.
Examination, ultrasound and biopsy.
Very good, very good. Biopsy zaruri hai. Very good. Clinical breast examination. Yeah. So, FNAC out, sorry. Actually this, yeah, I agree. FNAC out. No, we are no longer doing FNAC. Yes, ma'am.
FNAC is not completely out. अगर cystic है mass तो उसमें आज भी solid है तो कभी भी नहीं करना है FNAC.
मैम cystic में तो कर सकते हैं. Okay. So, मैम cystic FNAC recommended hai, ma'am. Clinical breast examination, imaging with ultrasound, mammogram or MRI, and pathology. So core biopsy is the ideal thing. What is BIRADS full form? Breast imaging. Yes. Breast imaging, reporting and data system, standardized scoring 0 to 6 for imaging interpretation. So this is all. हाँ नहीं मैम डिटेल में बता रही हूँ. BIRADS 0 to 6. So we start with BIRADS 0. A score of 0, it indicates an incomplete test. The mammogram images may have been difficult to read or interpret. So it's an inconclusive thing. BIRADS score 0 requires additional tests and images to provide a final assessment. The next is BIRADS 1. BIRADS 1 category shows study was negative, no evidence of cancer, 0% malignancy, but still follow-up and screening is essential. Then BIRADS 2, it shows the study was normal, but other findings like cysts, calcifications, fibroadenomas, benign conditions, they may be mentioned. And in such a case, mammogram annually, once a year, but malignancy is not there. But still we have to keep the patient on follow-up. Then BIRADS 3, BIRADS category 3 lesions, most probably they are benign, recommended to undergo short interval follow-up imaging at 6, 12 or 24 months, and malignancy rate is 2% or less. Coming to BIRADS 4, BIRADS 4 indicates a suspicious abnormality in a breast lesion that may be malignant. Malignancy for a BIRADS 4 lesion is between 3% and 94%. It could be anything. That means BIRADS 4 lesions are further subcategorized into 4A, 4B and 4C based on the likelihood of malignancy. 4A means 3 to 10% probability of malignancy, 4B is 11 to 50%, and 4C, most malignant, 51 to 94%. BIRADS 4A and 4B are classified as benign, and 4C is classified as malignant. And a biopsy, core-needle biopsy is recommended for BIRADS 4 lesions. Coming to BIRADS 5 now. BIRADS 5 on a mammogram means that the findings are highly suggestive of malignancy and have at least a 95% chance of being cancer. This result is given after a diagnostic mammogram, and a radiologist will strongly recommend a breast biopsy. It requires core needle biopsy, and the treatment is surgical excision if the core needle biopsy is not malignant. BIRADS 6. BIRAT 6 known biopsy proven cancer. Appropriate action has to be taken well in time, and to be perfectly honest, if a patient has a rating of 6, it means cancer is there and we have to be very vigilant in the treatment started ASAP, as soon as possible. Next question, so now we are done with the BIRATs. The next question is, what are the most common symptoms? What sort of lump? Good, good. Painless and hard lump with irregular borders. The next is breast pain usually cancer? If in case it's an inflammatory, this thing. So, no, mastalgia alone is rarely due to malignancy, it's less than 5%. Yeah. What is the screening tool for dense breasts? Okay. Digital breast tomosynthesis or MRI in high-risk women. Same. MRI for high risk. Is FNAC sufficient for diagnosis of breast cancer? Yes. So, core needle biopsy is preferred. It gives proper histology, the receptor status, that is ER positive or negative, progesterone receptor positive or negative, HER2, human epidermal growth factor, positive or negative, and Ki67. How do you evaluate nipple discharge? Bloody, unilateral, spontaneous, requires imaging, cytology and duct excision. Milky, greenish or bilateral, it's usually benign. When to suspect hereditary breast cancer? Yes. Triple negative. Breast cancer less than 40 years, bilateral tumors, triple negative, TNBC, less than 60 years, male breast cancer, and the history of ovarian cancer in family. What is the role of MRI in breast cancer? High risk. High risk screening, BRCA positive, evaluating multifocal or multicentric disease, implant assessment, occult primary and metastatic axillary nodes. How to manage breast cancer during pregnancy? होते हैं. So you have to do ultrasound, it's safe, core biopsy is safe, surgery with anthracycline chemo after first trimester, definitely. You have to avoid radiation and these trastuzumab, I'll be just coming on that, and endocrine therapy during pregnancy.
It depends on what time of the pregnancy the patient is
Yeah.
presenting.
But radiation and these trastuzumab and all have to be definitely avoided. What is the best contraception for breast cancer survivors? Non-hormonal copper IOD, avoid estrogen level and ER positive and IOD. Levonorgestrel IOD has to be avoided cautiously in the ER positive patients. How to approach a breast lump in lactating women? Yeah, ultrasound plus core biopsy if suspicious. And then lactating adenoma, galactosile, they are common. And definitely mastitis, we all know, needs antibiotics and proper drainage. Can HRT be given in breast cancer survivors? Systemic HRT is contraindicated and ER positive survivors. Local vaginal estrogen only if severe genitourinary symptoms, and non-hormonal therapies fail. What are the red flag signs of inflammatory breast cancer? Rapid onset of erythema, pudgy orange, edema of more than 1/3 of breast, axillary lymph nodes positive, so the diagnosis would be biopsy, plus, and if in case there is dermal lymphatic invasion, then definitely. When is a sentinel lymph node biopsy preferred? Clinically known negative tumors less than 5 centimeters, not done if obvious axillary metastasis is there. What are the endocrine therapy options? Premenopausal में tamoxifen, postmenopausal में aromatase inhibitors, letrozole and anastrozole. What about follow-up after the treatment? every 3 to 6 months for the first 2 years, then annually with clinical examination and annual mammogram of the preserved breast. Is there any role of immunotherapy?
Annual mammogram of the preserved.
Preserved breast. Is there any role of immunotherapy? Pembrolizumab can be given in PD-L1 plus metastatic triple negative breast cancer. If you want to know more, I have notes made, I can elaborate on that.
ऐसे करेंगे ये और खत्म करो.
What is targeted therapy? Trastuzumab, pertuzumab in HER2 positive tumors, which should be continued for 1 year. What about male breast cancer? 1% of breast cancer, strongly ER positive, and tamoxifen is the first line treatment. Fertility preservation after breast cancer. Embryo or oocyte cryopreservation before chemotherapy and GnRH analog sleep-right वगैरह during chemotherapy to protect ovaries. Thank you. If you want, I can just elaborate.